teachers, we always give everything. We sacrifice everything for our students. But now this time, it's a matter of life and death.
And I know many teachers and faculty are chomping at the bit to get back in the classroom because they know how much their students depend on their instruction and on their tutelage. Our fight against COVID shouldn't lead us to deprive our kids of the tools they need to succeed.
If some schools were to reopen per the governor's orders, what do you think is the worst case scenario? How does that play out?
People die. People will die. The main point of the lawsuit is to get the governor's attention, because he hasn't been listening to us otherwise, to make sure that schools do not open as brick and mortar buildings, because we know how dangerous it is. We know that not only are the lives of the staff members and their families at risk, but also the lives of the children that we serve.
We've been historically underfunded already, and then if you add all of this on top of it with the personal protective equipment we would need to open schools safely, where is the money coming from for that?
I spend a lot of money, like with materials and things like that. I take away from my household, my family, you know, from my students, because I want to give them the very best. So to take away more funding, it leaves me very worried of how next year will look for me, because I will have to go more into my pockets, and I'm already underpaid as an educator.
We already have a shortage. We already had last year a teacher shortage in the state of over 3,000 classrooms did not have a teacher at the beginning of the year. And so this, you know, we've heard that teachers are going to be leaving the profession. That's just going to make it much worse.
There is nothing I want more than being back in front of my students. I love my job. I get paid to be goofy and sing songs and teach kids about music. But this is keeping me from doing my job because the virus has not been dealt with like it needs to be.
Dasha joins me now outside a high school in Miami. Dasha, we just heard their concern there, and one teachers union in Florida has filed a lawsuit surrounding the reopening of schools. Tell us about that and just a little bit more about how these teachers are feeling that you spoke with.
Yeah, Savannah, I got to tell you, it was such a powerful conversation to just sit down with these teachers for an hour and hear what's top of mind for them, because they are thinking about this 24/7. And it was so clear the love that they have for their students in this conversation that came through powerfully. And they just want to keep their best interests in mind. One of the teachers you met there, Mindy, is actually a plaintiff in that lawsuit. And she told me that part of the reason they filed it was to get the governor's attention. They want him to hear what these educators are saying, because as you heard in that press conference he gave yesterday, he's continuing to double down on that push for schools to reopen. This morning he also tweeted saying he wants parents to have a choice between distance learning and in-person learning. But these teachers, they say that right now Florida is the world's epicenter, one of the world's epicenters for the virus, and to reopen schools during this time would be incredibly dangerous from their perspective. Now, the other element in this lawsuit, and you heard a lot about funding there in that conversation, that is also part of the suit. Right now, schools get money based on butts in seats, so students actually in these buildings. What they want to make sure is that if schools are virtual this semester, that funding remains in place. They say they will still need it, if not more so, to ensure that students have the technology they need to access these classes and to prepare for when eventually and hopefully schools do reopen in person. They want to have the right PPE in place, the right resources to reopen safely when that does happen. Savannah?
So other than something like PPE, did they say what would make them feel safe returning to the classroom? When? Some type of indicator that it's okay to go back?
Yeah, well, you heard there, they do want to be back with their students. Nobody is arguing that in-person learning is not the best way to go. Everyone wants students in classrooms, but they want to see the virus under control before that happens. They want to see positivity rates go down in the state. They want proper plans and protocols in place. One of the criticisms I heard from them about the governor's plan was that it's not much of a plan. He doesn't tell these school districts what they should be doing. He really leaves the details up to these individual localities, and they say that doesn't make them confident moving forward. They're teachers, they're planners. They want to have these steps, these protocols in place, and importantly, the funding to actually implement those protocols. One of the teachers told me not having those resources would be like going to war without any weapons. Savannah.
So, Dasha, what are they going to do? I mean, are they going to follow the governor's orders and start in-person classes? We obviously just heard their concerns about it, but how's this going to play out?
Right. I'm actually standing in one of the oldest schools in Miami right now, and it's still not clear if these halls will have students in them come August. The district, the superintendent of Miami-Dade still has not issued a final call, but as of yesterday, he did say that it's unlikely that students would be coming back to these buildings come August, but they've yet to decide. Now, next door, Broward County already has announced that they will be starting the school year all online. So it does seem like most of these districts are dealing with it and making their own decisions based on what they see best for their own communities. Savannah?
It's an important debate that we're seeing play out across the country. Thank you so much, Dasha.
Thanks.
Coronavirus cases are rising so fast in Texas, contact tracers are struggling to keep up. NBC News correspondent Morgan Chesky joins us now from Houston. Morgan, we know these contact tracers are overwhelmed. What are they telling you? What's going on here?
Yeah, Savannah, good afternoon. It really is just a numbers game that's never in the state's favor, at least up until this point in time. And we are starting to see slight drops statewide when it comes to the new daily cases. We knew that for several days, Texas was seeing more than 1,000 new cases a day. We know that that number has started to drop down into the hundreds, but even so, from Dallas to Houston, Austin to Amarillo, the numbers are still so significant that we're seeing delays of up to 2, even 3 weeks, sometimes not even a phone call at all from these contact tracers. And essentially what that does is it makes their efforts useless. We know that several hundred of them were brought on board when this pandemic really started going here in the state to at least try to track down these cases in hopes of using that as a means to contain the virus. But Savannah, right now, it's really the numbers are too high. And so until we can start to see some serious containment and those numbers drop even more, their efforts will be, for the most part, futile. Savannah?
Absolutely. And now Harris County, where the bulk of Houston is and where you are, has more than 58,000 coronavirus cases. I mean, just when you hear that number alone right there, you can imagine how difficult contact tracing is with that. But you spoke to the mayor of Houston. How is he responding to this?
Yeah, Sylvester Turner is pointing to at least a glimmer of hope in that hospitalizations have stabilized and that new cases are starting to decrease. But he's not even calling it really a decrease. He's saying that at this point in time, people need to keep doing exactly what they're doing because there is a bit of a lag time from when you implement a new measure to when you finally start seeing those results. And several leaders are saying that these decreased numbers at least can be some part traced back to a July 2nd action that was taken by Governor Greg Abbott when he said that any county with at least 20 COVID-19 cases or higher had to have masks up when people are going into any establishment in that area. And so right now, the mayor of Houston had optimism in his voice when I had a chance to speak with him, but he also said that it's too early to give up. I want you to take a listen to what he said just a short time ago.
And so our positivity rate is still right around 20%, 25%. And so we need to drive that positivity rate all the way down to 5% or below. So we still have a long way to go. Okay, though we're seeing some slight improvement in hospital admissions and in the positivity rate, some slight improvement, we still have a long way to go.
That positivity rate, very slight improvement. It's still north of 20%, Savannah, and compare that to what we're seeing in New York City right now, whose positivity rate is at 5% or below. Houston has a long road ahead, as does the state of Texas, when it comes to containing this virus. Savannah?
You just mentioned New York, and I think one of the phrases that we all got real comfortable with real quick as New York was getting super bad was flatten the curve, and then talking about if we've reached the peak of that curve. Is Texas nearing its peak?
You know, if you were to ask doctors or local leaders, they would say it is still too early to tell. Everyone is hopeful when they see these numbers start to stabilize. They see a day or two where a decrease does happen. But if you go back just several weeks, we would have days like that followed by massive spikes. And so it really is too early to tell. There is acknowledgement that some of these proactive steps may be working. We know that if local communities haven't taken it upon themselves, businesses, we're already seeing, of course, Sam's Club, Walmart, Home Depot, putting in those mask policies if they're not already in place. And so that's why they're, at least the main message, I guess, from Texas, Savannah, is, you know, stay the course. I had a chance to hear from a local health expert who basically put that in his own words about kind of the current state of affairs is where Texas is in the pandemic. Take a listen.
We have not necessarily reached the peak. The hospital data is showing some slight, mild stabilization, maybe a little bit of dropping off of the total number of people that are in the hospital, but not the 700 or so, 650, I think it is, between 650 and 700 ICU patients within Harris County alone.
On the way to this very live shot, just right across the street from one of the testing centers that's been opened in Houston, I passed a billboard that said, "Too soon to stop now." And it was a picture of a person wearing that mask. It's going to be stinking up for a while, Savannah, and at least until these numbers become a legitimate downward trend.
Well, another thing that's the opposite of a downward trend is the surge in cases that we're seeing near the southern border in several states. What's going on there in Texas?
Yeah, South Texas is uniquely positioned to be put at a disadvantage when it comes to fighting this virus for a couple reasons. Number one, you have a high percentage of the population in South Texas that does not have access to health care or is uninsured. And so that already puts them at a bit of a disadvantage. Number two, you have the majority of the population down there has jobs where it's nearly impossible to work from home. We're looking at positions in agriculture, in industry, service jobs that really require you to be out interfacing with other people. That's also a contributing factor. And then you have the, another part of it, which is the Hispanic culture. We have multi-generations living in the same household there, making it really hard if someone is to get sick to isolate them from other family members. And so we do know that there have been instances where you'll have families where, one person will go to work, come back sick. The whole home then becomes basically a carrier of COVID-19. And then they go to hospitals which are already short on resources down there. And it becomes really a tragic snowball effect. When you look at how quickly the cases have risen there, how limited the supplies are at the hospitals in place. And that's why we do know that South Texas has been one of those places where those federal medical teams have been deployed to at least lighten some of the load, which is a surge in patients that they're still seeing as we speak. Savannah?
So tragic. Thank you so much, Morgan.
Thank you.
The number of coronavirus cases confirmed in the U.S. has surpassed 4 million. And as cases continue to rise, test results remain backlogged. It's a concern former FDA Commissioner Scott Gottlieb talked about today on MSNBC.
After about 48 hours, the test really isn't that useful for the clinical management of the patient. At that point, you're not going to be able to use the result to do effective contact tracing. Too much time has passed, and you're not giving information back to the provider and the patient that they could use to, sort of attenuate their own behavior.
NBC News medical correspondent Dr. John Torres joins me now. Dr. John, how useful are tests if you don't get results quickly, if after the test you're in limbo for a week or more?
In Savannah, Scott Gottlieb is exactly right. After a couple of days, the test doesn't become very useful for what we call prospective analysis. In other words, finding out if somebody has coronavirus, who they might have been around, who needs to be contact traced and quarantined. You need to get that within a couple of days. What it is useful for, even a week or two later, is prospectively looking back historically and saying, okay, this is how many cases we had. This is where the clusters were. Here's where we kind of need to keep an eye on things. But as far as moving forward in getting this pandemic under control, getting that testing under control is going to be one of the important things we need to do going forward here. And if you think about it, we've been talking about testing since February. We've been talking about how testing has not worked since at least March or April, and it's still not there. Now, part of the reason is because of the surge in cases, especially in those states that are hotspots. That makes sense that they're going to have issues because you can get the test done, but then you need to get it to the lab. There's only a limited number of lab personnel, limited equipment, limited number of reagents, which are the formulations, the chemicals they use to develop the tests. And so there are going to be bottlenecks in certain areas. But when you have 4 million cases, you have that many people getting it all at once in these hotspots, it's going to backlog. Trying to break through that is going to be important, and trying to figure that out, especially because we know even once we get this under control, this is going to happen again come in the fall when we get that true second wave coming. And so we need to get a better understanding, a better handle on it. And like I said, we've been doing this for 4 months. We're not quite there yet. We have another couple of months before we have to get there again. And we just need to make sure that works, or else we're not going to get this pandemic under control as quickly as we'd like, Savannah.
Just feels like there's so many aspects in which we are just not there yet. Now, the president maintains our rise in cases is because of our rise in the number of tests that we're doing. But take a look at this chart. It shows the difference between what you would expect from increased testing versus the rise in cases we're actually seeing. It's almost double. What does that mean about where we're headed? And can you just sort of break down some of those numbers in that chart we're seeing there?
And if you look at it, it's almost like a math equation where there are certain things that go into that rise in cases. More case testing certainly is one of the aspects of having that case number rise up, because the more you test, well, the more you're going to find. But at the same time, we're also noticing increase in hospitalization rates. Like they were just talking about earlier, we're noticing increase in positivity. That's the number of cases that are positive. Those are indications that beyond testing numbers itself, that those cases are actually rising. And unfortunately, I think over the next week or so, we're going to see an increase in the death rate as well. Hopefully not as much as we did back in April, but putting all those together, it shows that there's multi-factors that cause this increase in numbers, and testing is certainly one of them, but it might not even be the biggest one. The fact that there are more actual cases out there is a thing I think people need to understand, and it's not simply the fact that we're looking for more, we're finding more. And so getting it under control, people doing those things that they know they need to do to keep it under control is going to be extremely important, Savannah, especially going forward here.
So talking about something there that could maybe help us keep it under control, something that we as individuals can do. If you're someone who's waiting for a test result, how long should you be quarantining?
Well, Savannah, that quarantine period is 14 days. That's the incubation period of the virus itself. So if you're exposed to it on, say, day 1, well, you could actually start developing symptoms and developing the virus to the point where you're getting it contagious to other people at day 14. And that's why we say that 14-day period is very important. Early on, a few months ago, we actually found out that about 50% of people actually start showing symptoms and start having that virus that could be contagious at about day 5. Almost everybody by day 12. And that's why we say 14 days. So if you do test for coronavirus, more than likely you're testing because you think you have it, you were exposed to it, then you need to quarantine yourself for that 14-day period. After exposure, the important part here, it might take a week or two to get the test results back. The last thing you want to do is be walking around, getting around other people, getting other people sick, and then finding out you had coronavirus, because not only you can feel awful about it, but you're actually helping perpetuate the pandemic. And again, we want to get it under control as soon as possible.
And it's important to note that in those 7 days, you may be, or the whole time for that matter, asymptomatic. So just thinking that you feel okay does not necessarily mean that you are okay. Thank you so much, Dr. John, as always.
You bet.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.